Yes, when it's time, yes.
Do people calling normally?
Yeah, they do. If they have questions or something that they would like to get clarity on. But most times, since we are just talking about we're talking about the causes, symptoms, and all of that, so it's enough information for them already. Oh crap! If it's information,
You have to turn it level.
guess we have to leave it that way for now. Sadly.
Are you gonna have a break?
No, I'm like, are we going to have a break in the middle of the
Because
conversation?
no, I'm just running this way for now. Like if you're going to adjust it afterwards.
Yeah, I don't think I can adjust it for now. I don't know who changed the setting. It shouldn't be this way. Okay, coming in. Janko Rico by Ola Onabule, the British Nigerian that makes really beautiful soulful music. And right now it is Breakfast in Bed here on Smooth 98.1. We are about to talk about your eye health. Very important conversation. I think you should gather your family around because this thing does not respect age. Over time, a lot of conditions are, I mean, before now, there were some conditions that used to be for the older people, but now it's as if we're having a reduction in the causes, I mean, in terms of the age that is. So, yes, we are talking about cataract this morning. Now, if you want to get interactive with us in the course of the conversation, you can send your WhatsApp messages to 0809 4440981. And also, you can tweet at us at Smooth91FM is the handle, tag that handle, and use the hashtag Breakfast in Bed 981. I do have my specialist, my professional in the house this morning to talk about cataract. And she's a very beautiful lady. It's good to have her in the studio making our radio debut. Her name is Dr. Ada. I don't want to pronounce your surname because Maduagu.
You tried, you tried.
Oh,
Hi, good
thank you so
morning, good
much.
morning. Thank you so much for having me. I'm Dr. Madwago Ada.
Thank you so much for being here, Dr. Ada. Really a pleasure to have you because I think, no, I think June is Cataract Awareness Month, and it is
Yes.
very important that we spread information so that we do stem the tide of this condition. Now, one of the reasons I decided to talk about it is because of the data on it. I'm trying to, yeah. So, according to the World Health Organization, it is said that at least globally, 2.2 billion people have a near or distant vision impairment. And then, in at least 1 billion or almost half of these cases, vision impairment could have been prevented, or maybe some of them are yet to be addressed. Now, that number goes further, and there is a breakdown. Out of that 1 billion people, you have about 88.4 million having a condition of unaddressed refractive error. You have cataracts, which we're talking about today, occupying 94 million, or there are people, 94 million people who have cataract. That could have been prevented also. Then you have glaucoma being 7.7 million out of that number. You have unaddressed presbyopia. Pres-
Presbyopia.
Thank you. It gives me a headache all the time. That is 826 million. So we have diabetic retinopathy too, being 3.9 million out of that 2.2 billion people that are having vision impairment. And we just want to talk about this so that you prevent it. Now, going further, still on that, according to the report from WHO, it says that in terms of regional differences, you have the prevalence of distant vision impairment in low and middle income country or regions. It is estimated to be 4 times higher in high income regions. I mean, it is higher in low income compared to the high income regions. And then in Western, Eastern, and Central Sub-Saharan Africa, it is 80%. So, of course, Nigeria happens to be a part of that. So, again, that's one of the reasons we're talking about this. So, let's just go right into it. Cataract. What exactly is cataract?
So cataract. Let me first of all start with how the eye is formed. Just behind the eye, you have the iris, and behind the iris, you have the lens. The lens is normally clear, but in cataract, there's an opacification of this lens, so it is a clouding with time. All right, it's slow, it's painless. People don't know they have cataract until when it's at the latter age. All right, so cataract is the clouding of the natural eye lens of the eye. So it's slow, painless, but people don't know. And one major risk factor is aging, is a natural aging process. So when you're above 60, you start seeing signs of cataract. The first sign is you have start seeing cloudy vision. You start seeing, like, if you're having fog, you're seeing through a fog lens, or you're having fog cloudy vision, and you want to come and check your eyes. But the problem in Nigeria is that people don't prioritize their eye health. They don't go and until when it's late. When, oh, I'm not seeing again, I'm not seeing, I'm not reading well, I'm not seeing distance, I'm not driving well because my vision is reduced. And by that time it's already late, and you now tell the person you need surgery to remove, and the person now is in denial, like, surgery. Can I not do something else? And you're like, that's the only option to treat cataract.
So going by the patients, the number of patients you have seen, right? That is the number that people tend to come when it is late.
Yes.
Ah.
Yes, we don't prioritize eye health in Nigeria. Unlike, oh, you have malaria. Even malaria, you just want to go to the pharmacy and take it. But if you take it like yearly, you want to go visit your optometrist, you want to go visit your ophthalmologist, that, oh, I want to check my eye, just not because you have any symptoms or signs, you just want to check, is my eye okay? Because now we talked about glaucoma. Glaucoma has no signs. And the next thing is blindness. And something about cataract is preventable blindness. So if you come and we tell you have cataract, you do your surgery and we remove this cloudy lens, you can see. But people are surgery is like, oh, Mom, I don't want to do surgery.
Surgery is scary on a normal day, but then the fact that it is surgery when it concerns your eyes,
funny enough,
anything could go wrong. You couldn't blame them.
Funny enough, cataract surgery is one of the safest surgeries. Studies have shown. Done by a professional, that's the ophthalmologist. It is one of the safest, but everybody's just scared about surgery.
Now that you mentioned it, please tell me the difference between an optician, an optometrist, and an ophthalmologist.
All right, so these are the three O's. We call them the three O's of eye care. We have the optician, who helps dispense lenses prescribed by an optometrist. An optometrist is an eye care professional that helps treat, diagnose eye diseases. We refer cases like, you come to me now as an optometrist, and I see that, oh, this patient has cataract. I refer the patient to the ophthalmologist. Ophthalmologists are the higher, so you have the ophthalmologist, optometrist, and the optician. So the ophthalmologist help to surgical treatments. They are the ones. So these are medical doctors have gone for further study on the eye, just like the pediatrician do focus on the kids. So yes, that's it.
Okay. All right then. You have established that cataract is as a result of aging. It's part of the normal aging process. So are you saying that people who are younger than 50 can't have cataract?
Age is one of the common risk factors, but there are other risk factors which include
Okay,
trauma.
Just hold on. Before we get into the risk factors, I want that to come later on. But let's just talk about the types of cataract.
All right. So we have different types of cataract. We have structural. As I said, it affects the lens. So when the cataract affects the center of the lens, it's called nuclear cataract. If it starts affecting the temporal of the lens, it's called cortical cataract. We have also traumatic cataract, where people engage in fight and you just give a fist blow to someone's eye. Few days, the person might develop cataract. Might. Yes. We have steroid-induced kind of cataract. When you've been on steroid drug for a long time, you can induce cataract. We have also diabetic induced cataract. This is one of the common cause, because when diabetic patients have increased sugar levels, it also affects the eye, especially the lens. So the sugar also increases. That's why sometimes when a diabetic patient comes, I'm like, the first sign you know your sugar is high, you have blurry vision. So so you have in that type of cataract. Then you have also I've talked about traumatic. I've talked about, you have congenital cataract.
Which is that one?
Kids are born with cataract. Mostly, yeah, intraurinary
How?
from mother to child. When the mother has like measles or chicken
Mm.
pox, when she's pregnant, the child can come out with cataract. But when you diagnose that child has cataract, the child goes for surgery and the patient sees perfectly fine after the surgery.
I will have to hold you on that because I don't like the sound of it. So I'll take your breather now. And of course, we'll come back for it. This is Smooth 98.1.
Silky smooth. 98.
Your phone? Is it on?
Smooth 98.1. Love music.
Oh, okay.
Love life.
Fifi, what are you doing? Where you see calendar?
I'm canceling my savings countdown. Soft babe life in a little bit.
Huh?
My ultra slim retina display laptop from Ultimate will be here in about 3 hours.
On Ultimall, you can own now and pay later with flexible payment options of up to 24 months. The best part is there is zero interest on all products. So shop your home appliances, electronics, furniture, gadgets, and more now on www.altmall.ng. All small. Shop more. Pay easy.
All a part of
How's
the
it going?
Sunday
Oh, yeah,
brunch
pretty good. I like your
experience.
fire.
Sunday brunch. Jazz.
I think because I'm passionate about anime,
Yeah,
I can always just come through.
it's beautiful.
Number 1. The Sunday Brunch Top 20. Here
good.
is Smooth 90.1.
It's the kind of fire we
2
need.
till 3, where we play the top 20 smooth jazz soundtracks on the planet. The Sunday Brunch Top 20. Sundays from 2 p.m.
Smoother than a fresh jar of silky.
Smooth 98.1. I love music. I love alive. This is Breakfast in Bed. We are talking about eye health. I have my guest, Dr. Ada, and she's an optometrist. We are talking about cataract, and we've mentioned what cataract is, the data on cataract, why you should be aware, and of course, the types of cataract is what we are on. She mentioned congenital cataract, so please further shed light on that. Why an innocent baby coming to the world who has nothing, who has done nothing whatsoever, will come with that kind of situation.
It's quite unfortunate, but as I was saying, it's like passed from mother to child. All right, when the mother has an infection when she's pregnant, mostly chickenpox and measles, so the child can be given birth with cataract. But when surgery is done, the child sees better.
Sees better or it is eradicated.
It all depends because sometimes the mother will be like, I'm seeing some whitish. My child's eye is not normal, but the delay of let me go to the eye clinic or something might now be you come at a should I say at the dying minute where maybe there's complications or anything. But when you give birth to your child and you notice this and it's proper care is given at the right time, the vision will be back on time. Vision will be perfect. But now the delay and everything, the whole should I say you're like newborn, the financial or surgery and everything. The whole you might just say the child doesn't need the eye itself because some parents you come and like I didn't know, yeah, I didn't know it was not. I thought it was normal. So there are a whole lot of factors that can affect the child's prognosis after surgery.
Speaking of something normal, at least what we see and deem normal, when children are given birth to, sometimes within the first few days, you tend to see a lot of discharge from their eyes. What is that?
It's an infection. Discharge is not normal, but when they give them some eye drops, they help clean up the discharge and everything.
Okay, because I have had nephews, and sometimes you see them in the morning, and it's like the discharge is so much that they almost can't open their eyes.
Yes. It's maybe sometimes or it depends on the season. It's mostly allergic, so they just wake up with like, should I say, droopy discharge, and you die. Okay, just go for an eye check, and they'll give you some prescribed eye drop that'll help treat the infection.
Okay, well, you've mentioned nuclear cataract, you've mentioned cortical cataract, you have congenital cataract. I think secondary cataract, that's diabetic retinopathy.
Yes, and steroid.
Yeah, steroid also. You mentioned traumatic too, which is sad. I hope nobody gives anybody a punch or a blow in the eye so that.
Yeah, my consultant always say, please don't fight, don't separate fights, don't be any place close because you're like, I just came to someone's by next thing you're the person and a sad case.
Yes, especially as it looks like a number of Nigerians are angry, so please stay out of trouble. So let's talk about the causes of cataract. You've mentioned some of them. Age is one of it over
Yes.
time, and then as regards a childhood, the mother just passes it on. But okay, measles and chickenpox are the only things that can have cause congenital cataract, or what are the things that can cause congenital cataract?
You also have genetic problems too, but the main causes I said is age, then steroid use, then long exposure to UV, harmful UV light. I've said that it breaks down the protein levels in the lens and could cause.
Hold on, no. UV light, what comes to my mind is the sun. So are you saying that the more we stay in the sun, the more we are predisposed to cataract?
Studies have shown that long stay exposure to heat, UV, there are some harmful UV exposures, so it helps fast. Like the lens is made up of protein, so when you're under the sun, it breaks down this protein, and when you break down the protein, that's when cataract forms. So you just have to always wear your shades or wear your lenses that have photochromic properties. So when you're under the sun, it becomes like a shade.
Interesting. So those who use shade is not just for fashion.
Yes, definitely. It's like a healthy lifestyle.
Oh, now you know. What are some of the other causes? Okay, yeah, you've mentioned disease, we've mentioned radiation, we've mentioned, oh, smoking. I know that can
Smoking
affect.
and alcohol. Smoking and alcohol. It helps. It develops cataract.
So it just keeps breaking out the protein
Yes.
over time.
Yes, content of.
All right then. So what are some of the symptoms aside the cloudiness of the eyes? What are those things that you should be on the lookout for? Because while you were explaining, you said glaucoma doesn't have any symptom, but for cataract, are there pronounced symptoms?
The major pronounced symptom is this cloudy vision. It's just like if the person is seeing through a fog, harmattan. When patient comes in like I'm seeing harmattan, like fog, and you're like, yes, it's an early cataract you're experiencing. It slowly progress and becomes denser with time. Then you also have reduced vision, because with this cataract you have reduced vision. You can't see closely, and with time, this reduced vision comes to like you're not even seeing again, and it's time for surgery. Then you have increased light sensitivity. You start seeing halos around bulbs. Then you find it that you need more light to see closer, because now you're not seeing, but with light you could see better. Then you also have your prescription changes with time, because now as the cataract matures, your lens prescription also changes, because your eye doctor want to give you a perfect corrected lens prescription to manage your cataract formation until it is formed fully. Then it's time for surgery.
Until it is formed fully. I don't like the sound of what you're saying, Dr. Atta. So, okay, there are medications that stop the progression or they slow it.
That is dicey. There are some medication, because you see, cataract eye drop, but surgeries have not really. But the only thing that can really treat cataract is surgery. Yes.
That's just the only treatment.
Yes. When is that you have to just, and I've said it, the surgery is very safe.
Okay, how does it work? How does the surgery go?
So that's not my field, but what I'll just give you something that that I've said that the lens is a structure in the eye. It is opaque. When it's fully matured, it becomes very dense and you can't see. So the ophthalmologist goes in, take out this natural lens and put in an artificial lens, which is just where the lens is, and you perfectly see afterwards.
Where does the artificial lens come from?
It's already produced. So
I need to be sure, because last time I checked, there was one in which a person had the brain of a pig. Yeah, so maybe they can take it from another animal.
No, it's an artificial lens that is perfectly safe.
I see. All right, since surgery seems to be the only fix to cataract, how about we prevent it? What are the preventive measures?
Preventive measure is one. Always prioritize your eye health. Book an appointment. So the earlier you know you have cataract, it's better for you to prepare your mind that, okay, your vision is reducing based on your cataract there. Then avoid smoking, avoid alcohol, wear UV glasses or photochromic lenses. Then you also take, if you have blood pressure, have normal blood pressure. If you have high sugar level, maintain normal sugar level. Then if you're obese, exercise. So all this healthy livings, yeah. So,
well, just eat well, lose weight. It looks like we have the same preventive. Wait, what do you mean supplement?
Like eye supplementation. So you want to have eat well. Some Nigerians, we don't eat well. So you want to
what, according to what data? According to what? I do not agree. What do you mean we don't eat well?
Balanced diet. We don't have the required nutrients that are good for the eye health. Vitamins A, C, lutein, zeaxanthin. You won't really see. We don't eat broccoli. You don't eat leafy food. So, but when you take supplements, you helps to supplement what you're lacking. So,
Okay, two things first. I mentioned lutein,
zeaxanthin.
oh
Lutein and
dear.
zeaxanthin. These
All
are
right. So
key
what are
nutrients.
the foods that have them? And secondly, I'm not saying you should
Prescribe any.
prescribe. Yes. First off is the food, and secondly is the supplement. What to look out for when you're trying to get a supplement
Okay.
that works for your eyes.
All right. So food you want to look out for: eggs, carrot, veggies. So you want to eat veggies, then apples. Yeah. So anything that have vitamin C, high in vitamin C, vitamins. So you want to eat that. Then you also supplement. You have to look out for six key supplements, which is based on the Wheatstein's eye study, the Wheats 2 eye study. You have copper, zinc, vitamin C, lutein, zeaxanthin, and what's the last one? Vitamin E. These key eye nutrients are what you look out for in a good supplement. And I always prescribe Lipotried because it's really good.
I
And
hope that's not a brand name.
it is a brand.
No way. No, that is not. I'm sending the e-voice to you. Thank you very much for the advert. We are sending the e-voice to you. But is it possible, because I'm someone who's wary when it concerns the topic of supplements, because anybody can go out there and go and pick it and start using it. But is it possible that you have to take it, because supplements are supposed to be extract of nutrients from food, right?
Yes, please.
Can you overdose on them?
No. So that's why when you take a good supplement, they take it per serving that is good for your body. It's not over, and it's just like the dose is accurate. Like I said, serving size okay for your intake, daily intake. So you can't have enough, and the body is in a way that even if you have enough, it's going to break it down as waste.
Oh, so you can never take excess of it?
But you just take it according to the serving size. So if you're saying one per day.
You know why I ask that? Because different people think different way. It's possible that somebody has not had the time to take a supplement today or tomorrow and the day after, and then they say, "Okay, I have not taken my supplements in 3 days. How about I take it now?"
No, just one per day. So it's always when you take a supplement, you just check the back. What is the serving size? The serving size, okay. What you need per day that is good to give you the required nutrients. So it's usually maybe one per day, two per day, morning, afternoon. If you miss it, please don't take for your 3 days or your 4 days. That would not be good. That would be overdose then.
Okay, all right then. Meanwhile, if you have any question, we are almost wrapping this up. If you have any question you want to ask or something you want to clarify quickly, just I have the space for one call, just one call. So call the number 014489981. Again, 014489981. Or you can send your WhatsApp message to 0809 444 0981. We're talking about cataract, and my guest is Dr. Ada. She has broken it down what cataract is, the types of cataract, how it comes on, the causes, and some of the symptoms, and also what you should be on the lookout for. She says that it seems Nigerian, going by her experience and the practice, that Nigerians don't tend to come to the clinic until things are getting out of hand. And she also mentioned that surgery is the only fix, but you have preventive methods, and that includes you eating well, eating foods like that contain vitamin C, carrot, vitamin A containing foods. Earlier, I was giving data on this month being International Dairy Month, and I mentioned that vitamin A is contained in milk, and also, so I think also you should think about your milk product unless you are lactose intolerant. But there are also other milk products that are not necessarily animal products. So that's one thing. And she also mentioned supplements. I'm just trying to give a rundown. Yeah, she mentioned supplements. Please do not overdose on your supplements. Also, how often should a person see an optometrist? You know, for dentists, you see twice a year, but for optometrists, how often?
I always advise one time yearly, like once yearly. So you just have to book your appointment with your optometrist or your ophthalmologist at least once in a year.
Okay. All right, then we take a quick breather, and when we come back, we'll be wrapping this up. This is Smooth 98.1.
Love life.
World-class music.
Your program is still entertaining, right?
No, it's just 30 minutes.
I
My program, okay, yeah, my program stays till 10.
Smooth 98.1.
Fifi, what are you doing? Where you see calendar?
I'm canceling my savings countdown. Soft babe life in a little bit.
Huh?
My ultra slim retina display laptop from Ultimate will be here in about 3 hours.
On Ultmall, you can own now and pay later with flexible payment options of up to 24 months. The best part is there is zero interest on all products. So shop your home appliances, electronics, furniture, gadgets, and more now on www.altmall.ng. Ultmall. Shop more. Pay easy.
Hey, what's up, everybody? My name is Shay Shay.
I mean,
Smooth 98.1. Love music, love life. It's about your eye health. Right now, we are talking about cataract and we are wrapping this conversation up. On WhatsApp, I have a question from Charles Chidoji saying, my question is, if one is consistent on different types of fruit, is there still a need for supplements?
I don't think so. No, if you're constant, he says constant. So if he's constant with his fruits, I don't think he's meant to supplement. But it all depends. So now, if he goes for his eye check and he's not having like cataract, or the fruit might not give him the right amount of supplements that he needs. So now, but if it's just regular healthy lifestyle changes, I don't think he needs to supplement. Daily eating of fruits is already a good one. So yeah, but if he has any eye disease, that okay, you can please supplement and all that.
But I think that it's not vague. We need to be specific. Daily portion, how many fingers of banana, how many fingers of carrot, what would it be for you so that it achieves that standard of saying you're eating fruit every day? Because if you say eat fruit every day and the person just eats one small fruit, does it count? So what's the quantity or portion of fruit that you would say when it concerns eye health? This is what you should take. At least this.
I can't be specific, but at least if you're eating like a fruit, like a small fruit bowl daily, I think you have the required nutrients for your eye health.
Okay, all right then. And lastly, at least, let me reiterate this one. She said that you should always wear your sunshades outside and get UV glasses, right? UV approved glasses, or those photochromic lenses. Yes, I have one. Meanwhile, as we wrap this up, what would be a general recommendation to people as an optometrist who has come in contact with Nigerians with bad health seeking behavior? What would be your recommendation?
Prioritize your eye health. Book an appointment to your optometrist yearly. Don't wait for it to be too late when you have symptoms and you're already blaming your village people. So yes, prioritize your eye health. Thank you so much for having me.
Thank you. But I'll be your patient right now asking for free consultation. So there is this thing that happens sometimes when I do not get enough sleep.
Okay.
I feel very sensitive, extra sensitive to light. And it feels like my eyeballs are about to pop out.
Okay. So the thing is that that's why sometimes you don't need to have a refractive error to just wear your glasses that have anti-reflective coating like mine. It helps so your digital gadget permits UV radiations. Yes.
Okay, I should get my glasses.
Yes,
I have it
that's
in
why
my
you have
bag.
to always wear them. You see that with this reduced twitching you're having and times of eye fatigue will be reduced. It's not just for your back, it's for your eyes.
Thank you for shading me. All right, I will make sure my glasses is not always inside my bag.
Right.
Thank you so much. I look forward to more conversations with you
Thank you so
on
much for
eye
having
health
me.
later on. Yeah.
Definitely. Thank you.
You can catch Dr. Ada on social media. She creates a lot of content and she's all about the advocacy of eye health. She is Ask Dr. Ada on Instagram and Twitter. You can find her there. She's an optometrist. So yes, ask her those questions. I think she's very open to you asking questions, even if it's unsolicited. Right?
No. I always specify eye-related questions.
Okay.
Yes.
Yes, that's the context of the conversation.
I'm always there for free consult online.
Thank you very much. So Lagos, we will be back 8:40. It's time for the kids to come around and have a good time. And 9 o'clock is for Smooth Explorer. This morning it's about the karaoke. So you do not want to miss out on having a great time. This is Breakfast in Bed here on Smooth 98.1.
Right. Ask me the first question.
It's not a part of what you.
I think you like specific on. I'm like, okay, but I don't know like.
Oh, sorry. I didn't know. I thought since you already mentioned the recommendations of the fruits, I thought you could just. Oh, sorry about that.
No, you were like the quantity, like how
Yeah,
many?
because I mean it's vague that okay, just eat fruit. Well, so how much do I? Since he's mentioning it in terms of if I am consistent with it, what's the size that I need to have so that I don't necessarily need to take a supplement? So maybe
Now
3
depends
fingers
on
of this body.
What X? No, I don't know X amount of carrots gives X nutrient. You know, I don't know like the exact amount, but I think at least if you eat a full bowl of fruit every day.
How many Nigerians can get that every day?
That's the thing. So if you constantly doing that. All right, thank you, Shehu.
Thank you so
I'll
much.
go and watch my